How can non-invasive imaging replace invasive cystic fibrosis tests? Imagine a future where diagnosing and monitoring cystic fibrosis involves less discomfort and more safety. Thanks to advances in medical imaging, this future is becoming a reality. Traditionally, assessing lung and liver health in cystic fibrosis patients often meant invasive procedures like biopsies, which can be painful and carry risks like bleeding or infection. Now, non-invasive imaging techniques are stepping in to change that. For lung assessment, magnetic resonance imaging, or MRI, is proving especially useful. Unlike computed tomography scans, which use ionizing radiation, MRI uses magnetic fields and radio waves, making it safe for repeated use. MRI can detect early changes in lung structure, blood flow, and how the lungs respond to treatment, even in infants and young children. While CT scans are very sensitive for spotting lung abnormalities, their radiation exposure limits how often they can be used. MRI offers a safer alternative for ongoing monitoring, helping doctors track disease progression without exposing patients to harmful radiation. Although lung ultrasound is sometimes considered, current evidence shows it's not yet effective for monitoring cystic fibrosis lung disease. When it comes to liver health, elastography techniques are making a big difference. These methods measure liver stiffness, which indicates fibrosis or scarring, without needing a biopsy. Techniques like transient elastography, shear wave elastography, and point shear wave elastography are simple, reliable, and can be repeated over time. They work well alongside blood tests that measure fibrosis markers, providing a comprehensive picture of liver health. This approach allows early detection of liver involvement and helps in monitoring disease progression, all without invasive procedures. Replacing invasive tests offers many advantages. Biopsies can cause pain, bleeding, and other complications, making them less ideal for regular monitoring. While sweat testing and genetic analysis are essential for diagnosing cystic fibrosis, they don't give information about how the organs are actually doing. Imaging fills this gap by providing detailed, real-time insights into organ health. Detecting problems early means treatment can start sooner, potentially slowing disease progression and improving quality of life. Of course, there are still some limitations. International guidelines are still being developed to standardize how and when these imaging techniques should be used. Researchers are working to refine protocols, especially for liver elastography and advanced lung MRI. The integration of artificial intelligence into image analysis promises to make assessments faster and more accurate, further enhancing patient care. In summary, non-invasive imaging methods like MRI for lungs and elastography for the liver are transforming how cystic fibrosis is managed. They reduce the need for invasive procedures, provide safe and repeatable assessments, and help catch organ issues early. These tools complement traditional tests and are part of a broader approach that emphasizes personalized care. Always remember, medical decisions should be made in consultation with healthcare professionals who can tailor treatment plans to each individual's needs.